Just published June 26, 2026, the Infectious Diseases Society of America's newest guideline on prevention of invasive aspergillosis in adult solid organ transplant recipients. The purpose of this guideline is to provide evidence-based reviews and guidance for practitioners managing adult patients at risk for or with suspected or documented Aspergillus species infections. In today's rapid update, we'll just be going over a summary of key recommendations and conclusions. So for the full guideline, make sure to check it out on guidelinecentral.com. Let's get started. Starting with the section on liver transplant recipients. In liver transplant recipients, the guideline suggests against using universal anti-Aspergillus prophylaxis. In liver transplant recipients, the guideline suggests targeted anti-Aspergillus prophylaxis for individuals at high risk of invasive aspergillosis. In liver transplant recipients requiring anti-Aspergillus prophylaxis, the guideline suggests using an echinocandin or a newer anti-mold triazole rather than amphotericin B formulations or itraconazole. Next, the section on kidney transplant recipients. Given the low pooled incidence of invasive aspergillosis or IA, the use of universal anti-Aspergillus prophylaxis is expected to provide limited benefits and thus a less favorable balance of benefits and harms. The current available evidence does not support the use of universal IA prophylaxis in kidney transplant recipients. Onto the section on pancreas transplant recipients. Given the low pooled incidence of IA, the use of universal anti-Aspergillus prophylaxis is expected to provide limited benefits and thus a less favorable balance of benefits and harms. The current available evidence does not support the use of universal IA prophylaxis in pancreas transplant recipients. Then the section on lung transplant recipients. In lung transplant recipients, the guideline makes no recommendation for or against universal anti-Aspergillus prophylaxis. In lung transplant recipients, the guideline makes no recommendation for or against any targeted anti-Aspergillus prophylaxis or preemptive therapy rather than universal anti-Aspergillus prophylaxis. In lung transplant recipients in whom anti-Aspergillus prophylaxis or preemptive therapy is being considered, clinicians should select agents based on the following factors: adverse events profile, drug-drug interactions, ease of administration and tolerability, associated costs and resources, availability, as well as local epidemiology. And last, the section on heart transplant recipients. Given the relatively low pooled incidence of IA, the use of universal anti-Aspergillus prophylaxis is likely to offer limited benefits and a less favorable balance of benefits and harms. The current evidence does not support routine universal prophylaxis against IA in heart transplant recipients. And there you have it. Make sure to check out the full guideline from the Infectious Diseases Society of America and other related clinical decision support tools at guidelinecentral.com.